Have you heard or read about H.R. 1, the One Big Beautiful Bill Act? How about the news that New York finally has a budget for fiscal year 2027? Mabuiga, welcome to the Garifuna Experience podcast. I'm your host, José Francisco Ávila. In this episode, we explore how H.R. 1, the One Big Beautiful Bill Act, threatens the health and well-being of the Garifuna American New Yorkers. What is H.R. 1 and why it matters? H.R. 1, also known as the One Big Beautiful Bill Act, is a sweeping federal legislation that fundamentally alters the nation's economic and social safety net. The social safety net is a collection of government programs designed to protect vulnerable individuals and families from economic hardship and poverty. H.R. 1, the One Big Beautiful Bill Act, includes massive spending shifts. Specifically, the bill redirects over $100 billion to border enforcement and immigration measures, making Immigration and Customs Enforcement, ICE, the single most funded federal law enforcement agency by 2029. To fund these shifts, the legislation makes significant cuts to federal safety net programs, including a 12% reduction in Medicaid spending. In New York, these changes could strip health insurance from up to 1.5 million people over the next decade. Garifuna American communities, including children, immigrant families, seniors, healthcare workers, and college students, stand to be directly impacted by these federal cuts. Why the cuts in H.R. 1, the One Big Beautiful Bill Act, matter to Garifuna communities in New York? Many Garifuna residents in New York State are foreign-born, with a significant number living in mixed-status households that include undocumented family members. At the same time, Garifuna Americans are essential contributors to the city's healthcare system, the small business sector, and frontline industries. Deep cuts to Medicaid, the Essential Plan, and food assistance combined with increased administrative barriers threaten much more than individual families. They directly erode the vital support systems that hold our local communities together. Impact on Garifuna New Yorkers using Medicaid and the Essential Plan. H.R. 1, the One Big Beautiful Bill, adds strict work requirements and burdensome administrative red tape that will make it harder for individuals to access or keep their coverage. 1. More frequent redeterminations. The bill requires Medicaid recipients' eligibility to be evaluated at least every 6 months instead of annually, creating an ongoing paperwork barrier that often leads to eligible people losing coverage due to procedural confusion. The digital and language divide. Because many Garifuna residents have limited English proficiency or lack reliable broadband internet access, navigating this constant paperwork hurdles is especially difficult. Threats to the Essential Plan. In response to these federal funding cuts, the Essential Plan, which covers low-income and immigrant New Yorkers, is undergoing structural changes. New York State is facing the loss of billions in federal funding, threatening to leave approximately 450,000 New Yorkers facing coverage loss. Families and children will lose access to care. The sweeping cuts also impact programs like the Supplemental Nutrition Assistance Program, SNAP, and the Children's Health Insurance Program, CHIP. Healthcare caps, cuts and restrictions to the Children's Insurance Program, CHIP, mean many Garifuna children may lose access to routine checkups, immunization, and prescriptions. This is highly critical given that approximately 123,000 children, or about 38% in the Bronx, live below the federal poverty line. Food insecurity. Restricting access to SNAP places vulnerable families at direct risk of hunger and limits nutritional support for developing children. Increased barriers for Garifuna elders. Older New Yorkers will bear a heavy burden under the new federal guidelines. Expanded work mandates. The law broadens work requirements for SNAP recipients. up to age 64 for those classified as able-bodied adults without dependents. Proven exemptions. Many older Garifuna adults risk losing their food assistance simply because they struggle to navigate the complex paperwork required to prove an exemption due to illness, disability, or unrecognized caregiving duties. Employment discrimination. Finding a job to meet this 80-hour per month requirement is an uphill battle for many older adults, facing persistent age discrimination in the workforce. Healthcare job loss and strain on our communities. H.R. 1, the One Big Beautiful Bill Act, directly threatens healthcare providers across New York State. Bronx workforce impact. New York faces massive uncompensated care costs. This places severe financial strain on safety net hospitals, particularly in the Bronx, where many Garifuna healthcare workers live and work as nurses, aides, and technicians. Language and cultural gaps. When safety net hospitals face layoffs and service cuts, our communities lose more than just jobs. They lose healthcare professionals who provide essential language access and cultural competency to patients who need it most. The federal One Big Beautiful Bill Act severely restrains New York's budget by slashing an estimated $13 billion to $15.4 billion annually in federal funding, creating immediate deficits that state and local lawmakers are forced to address. Notably absent in the recently passed New York budget, however, is any specific relief for the roughly 450,000 New Yorkers set to lose coverage under the Essential Plan at the start of July. A shield for New Yorkers. A State Senate Bill S-9589. In response to this looming crisis, New York State leaders are actively fighting back. On March 26, Senator Gustavo Rivera introduced Senate Bill S-9589. This critical legislation aims to protect New Yorkers from the fallout of H.R. 1, the One Big Beautiful Bill Act, by establishing a state-only premium assistance program, providing state funds to maintain coverage for lawfully present immigrants who are losing federal subsidies, preserving essential plan benefits, authorizing New York State to step in with state-only funding to maintain coverage for residents with incomes between 200% and 250% of the federal poverty line who will otherwise be left entirely uninsured. While S-9589 is currently referred to the Senate Health Committee, it represents a vital effort to ensure that health care remains a fundamental right for all New Yorkers, regardless of federal policy changes. An increase in immigration enforcement puts Garifuna New Yorkers at risk. H.R. 1 allocates over $100 billion through 2029 to ICE, representing the largest expansion of interior immigration enforcement in U.S. history. This massive infusion of funds shifts the federal emphasis heavily toward detention and deportation over legal pathways, humanitarian relief, and due process. For Garifuna communities in New York, the consequences are severe. Increased risk of family separation. Many Garifuna immigrants living without status work in sectors such as restaurants, construction, and other service industry that are highly vulnerable to workplace enforcement. Expanded detention capacity increases the risk of sudden arrest and family separations. Community movement and fear. Increased fear of immigration enforcement deters families from utilizing crucial city services, seeking preventive medical care, and reporting local crimes, which ultimately undermines overall public health and safety. Limited protections. While New York City's sanctuary policies offer some protection, the massive increase in federal resources expands ICE's reach into surrounding areas, directly endangering Garifuna New Yorkers who commute or work outside of the city limits. Increase financial barriers to legal status. H.R. 1, the One Big Beautiful Bill Act, significantly increases financial barriers to legal status and humanitarian relief for undocumented immigrants. The law introduces substantial fee hikes that make navigating the immigration and asylum system unaffordable for many. Mandatory asylum fees. Introduces a non-waivable application fee of at least $1,000 for asylum seekers, alongside an additional $100 annual fee while the application is pending. Work authorization costs. Imposes steep fees for employment authorization documents associated with pending asylum cases. Parole or temporary protected status, TPS, including a minimum $550 for first-time applicants and at least $275 for yearly renewals. Humanitarian protections establishes a minimum $250 fee for special immigrant juvenile status and a minimum $1,000 fee for anyone entering the country under a grant parole. Visa bonds requires a mandatory $250 visa bond fee for all non-immigrant visa applicants. Furthermore, a new 1% excise tax on non-bank remittance transfers directly impacts Garifuna Americans who send money back home to support loved ones abroad. The federal One Big Beautiful Bill Act severely strains New York's budget by slashing an estimated $13 billion to $15.4 billion annually in federal funding, creating immediate deficits that state and local lawmakers are forced to address. Notably absent in the recently passed New York budget, however, is any specific relief for the roughly 450,000 New Yorkers set to lose coverage under the Essential Plan at the start of July. And that wraps up another illuminating episode of the Garifuna Experience podcast. Thank you for listening. Remember, the future of the Garifuna people is in our hand. Until next time, stay united, stay proud, Sungube Lida Aba. Ayo. Find new episodes of the Garifuna Experience podcast every Tuesday on Spotify, Apple Podcasts, iHeart Podcasts, YouTube, Amazon Music, or whatever you find your favorite shows. Please rate and review the Garifuna Experience podcast. It helps our history reach the world.